in concept for the elderly because most have some form of systemic disease, and that causes them ailments, which in turn affects them physically and also mentally. Any type of chronic pain or ailment can drain someone of their desire to have a more successful existence, as stated in the definition of wellness. I also think most elderly wouldn't consider themselves necessarily healthy, even if they have either if they have one or more systemic issue. And again, outside conditions can also have effect on them. These are another example of social determinants of health. If they have grandkids, they might be more motivated to keep themselves healthy because they want to be around longer to have more time with their grandkids. And if they don't have family around or any grandkids, they might not care as much. And I personally have seen this a lot. I'll I'll have an elderly patient come in and I'll go, "Oh, how's your day going?" And the ones I've noticed that don't have family are just like, meh, another day, and they just don't really have much to live for. They can't really get out and do much. So that can definitely affect their health and wellness and be a really big social determinant of health. So next we're going to look at some behavioral models to identify how they believe, the things that they believe, why they believe what they believe, and why these things affect their actions. So we're going to start with the health belief model. The health belief model is a theoretical model that can be used to guide health promotion and disease preventative programs. It is used to explain and predict individual changes in health behaviors. It is one of the most widely used models for understanding health behaviors. The model defines the key factors that influence health behaviors as an individual's perceived threat to sickness or disease, which is perceived susceptibility, belief of consequence, which is perceived severity, and potential positive benefits of action, which is perceived benefits. Perceived barriers to action, exposure to factors that prompt action, which is also cues to action, and confidence in the ability to succeed, which is self-efficacy, which also can be related to health and wellness. I added another diagram here just to kind of put it more in a visual form. So their psychological characteristics and the things that are surrounding them or how they are, like gender and age. And that's why I chose this health belief model, is because age is a demographic variable that can attribute to some of these barriers. These things affect their perceived susceptibility and all the things I mentioned, and their motivation and their benefits that they see versus the barriers that they've got going on, and therefore shows what actions they choose to take. So this is a long slide. A lot of this I've kind of already covered, so I'm just going to skim it. A lot of them have health conditions that can cause periodontal disease, and a lot of them are not aware that these issues can be happening if they're not going to the dentist. They don't know that these health conditions can be made worse by periodontal disease. And then again, a lot of them have dexterity issues, so a lot of them are not cleaning their teeth well, and they don't even realize that they're not cleaning their teeth well. So it's really important that if we were able to communicate to the elderly the effects of periodontal disease and tooth decay, and can also assist them in recommending tools such as an electric toothbrush to more effectively clean their teeth, there would probably be improvement of their oral health as a whole. So basically, how the behavioral health model is used in this scenario, all 5 of the behavioral health model components are utilized. So these are the 5 behavioral health component or model components. Gathering information about this patient, conveying the consequences of the health issues, so explaining that if they have periodontal disease, it could affect their other systemic diseases, communicating to the target populations the steps that are involved and taking the recommended action, so explaining that they need to do this to have a better outcome, and then providing assistance in identifying and reducing barriers, so just really coaching them and encouraging them, and demonstrating actions through skill development activities and providing support that enhances self-efficacy and the likelihood of successful behavior changes. So really giving them a reason as to why they should be helping themselves more. So I think all 5 of those are used. So the next behavioral model that I want to look at is social cognitive theory, and I think this is another huge one with the elderly. So the social cognitive theory describes the influence of individual experiences, the actions of others, and the environment factors on individual health behaviors. The social cognitive theory provides opportunities for social support through instilling expectations, self-efficacy, and using observational learning and other reinforcements to achieve behavioral change. So these are some of the key components of this theory: self-efficacy, behavioral capability, expectations, expectancies, self-control, observational learning, and reinforcements. This honestly, I feel, really lines up well with the behavioral theory that we just previously discussed, because I think a lot of the same things apply here. I also have added this chart on the right hand, which also just shows how all these things relate to each other. The environmental factors can have an influence on the cognitive factors, which can have an influence on the behavioral factors, and so on and so forth. So I like how it kind of goes around in a circle almost. They all can affect each other. So again, I've discussed a lot of this already, so I'm going to skim through it. But many elderly are strongly influenced from what their parents taught them as a kid. And so before I mentioned scrub brushing, that's a huge thing. I see it all the time, but they just learned when they were a kid, man, the harder you brush your teeth, the better you're going to be. And now they have severe recession, and a lot of them are having to get gingival grafts and relearn that, no, that's not correct. Another huge thing that I haven't mentioned so far is back in the day, dental care was not as common as it is nowadays. And so they were used to not going to the dentist that often and that being okay. And some of them don't realize that it's a lot more important than what it was portrayed to be in the past, and that they need to go more. And then another really good one is that anesthetic techniques were not as developed as they are now, and so a lot of them had a really bad taste for the dentist. I'm sure you all have had experiences where elderly come in and they're like, oh yeah, back in the day they had to pull out like 6 teeth without any anesthetic and blah blah blah, and oh, the x-rays, it was like putting a credit card in your mouth and all that kind of stuff. And so they just have really bad experiences from that, and they don't even realize that nowadays we've made things so much more comfortable for them. So their social norms are influenced. Their social norms and influence of others change their expectations and attitudes. So we're looking and seeing how these social determinants of health have changed the way that they are doing things. So some of the key concepts that I mentioned earlier that we are using to identify the problem are their expectations, their expectancies, and their self-control. So regulating and monitoring individual behavior. So basically, I'm going to go over a summary of this needs assessment. So far we've talked about the elderly and their demographics, which is the step 1 in the 3-step plan of what is. This is what the chosen population is. Number 2 is gather and analyze data, which we have done. So we've discussed the social determinants of health and why it's causing drawbacks to their health. We're also analyzing the elderly in comparison to these behavioral models that I just mentioned. And so we figured out why they believe what they believe and how they're influenced by, and how they make their decisions. So the 3rd step would be to prepare a report, which we are doing now, and then also selecting strategies. So overall, I'm going to do a conclusion, and I'm going to talk about some of the strategies to fix some of these problems. I think 2 of the primary reasons why elderly do not receive dental care is due to lack of insurance and awareness. If they were aware that periodontal disease can cause and contribute to so many health diseases, many would probably put more emphasis on their dental visits. Many are also not aware of available public health services that are designed to assist the elderly that do not have dental insurance. I believe the first step in making a difference in their lives is reaching out to the elderly in Colorado in a way that is not online and offering information about periodontal disease and giving them a list of grants they could apply for or clinics close by that they could attend. This could be in the form of pamphlets mailed to them, information booths at grocery stores, or even announcements on the local news, because I do believe many elderly watch the news on TV. If we were able to do this and bring the elderly into dental clinics, then we would be able to coach them or their caretakers more on the importance of dental care, encourage helpful devices such as electric toothbrushes, and encourage them to live overall healthier lives. And I believe this in and of itself would have drastic effects on their lives. So I think that's definitely step number 1, is just creating more awareness. So these are my references, and then these are my picture references. So thank you so much for watching.